So I mobilized this foot in the manner in which I described in the previous film. And there's one more thing that I did. Would you lie on your right side, please? And now lay on your left side. So the very last thing I did after doing everything I showed in the previous video, let's take this leg behind you. All right, thank you. Is that I did a medial glide to the talus. And I have found that this is a very important finishing move. I call it the icing on the cake. And if I don't do this, it seems like they still have some residual pain. So I put the foot in neutral. Okay, just neutral dorsiflexion, and there's a 90-degree angle there. And I come on the talus, which is just hardly accessible, right under the lateral malleolus, this is part of the fibula. And I also contact on top of the fibula, and I just glide medially, and I take up all the tension, and then I did 30 little oscillations, little tiny thrusts. Okay, so that's the one thing we didn't show earlier. Let's have you lie on your back, and we'll show the results. So we can now dorsiflex equally. We restored that movement. The fibula now has vertical mobility, that little tiny motion in that joint. And now when I capture the front of the lateral malleolus, I can get a little bit of tiny posterior spring motion. Do you feel that? Mm-hmm. Okay, that's a normal movement. And now I come up below the knee. Okay, so here's his patella. And I come below that. And there's fibular head right there. Right there's the fibular head. And I come on the back of it. So I'm stabilizing tibia and I'm pulling it forward and outward. Do you feel that little bit of give?
Yeah. Good.
So we have good normal accessory motions in that joint. And now we'll come back and look at the foot in a little bit more detail. We now have, I bring one finger down until we get on the foot, and then navicular should be right there. We now have pronation of his midfoot, okay? And we have good up and down motion of the midfoot. And I come to the cuboid, and we now have good up and down motion of the cuboid. Okay? Now, his balance is somewhat improved. Let's go ahead and demonstrate. Well, let me demonstrate right now that there's still some muscle inhibition. Let's lift this foot up and out. Okay? And don't let me break it. Ready? 1, 2, 3, go. I'm still able to break that. Let's have you stand. And you do note that you have a little more stability, right? When you stand on the right foot?
Yes.
It's more stable?
Yes.
Okay? But when we stressed it with weights, then it revealed itself that it's still behaving differently.
Correct.
So go grab the 5-pound weights in each hand. And then, stand on your left leg and then just rotate left and right with that. So there's a little bit of challenge to that foot and ankle, but you seem to be handling it well, and now do it on the right. And tell me what you feel. Yeah, twice you touched down.
Yeah.
So you are more balanced, challenged on that side, correct?
Correct.
Okay. Go ahead and put the weights down and lay on your back. This is a reflex technique that I stumbled on, and I have a theory that there's clinicians, throughout the world using this, but it's not in the literature that I'm aware of. And what I stumbled on this working on my own index finger. My MP joint of my left index finger started to hurt. I had joint pain here. And I tested the ligaments, and I noticed that I could gap the metatarsal outward. Okay? So we would call that a lax joint, and we would call it a sprained lateral collateral ligament. but that was not a true diagnosis. I got inspired by Tom DeLonzo Baker, who's really developed a wonderful approach of treating the opposite side of the body with active movements. And I took his example that he showed me, and I thought, can you apply that active movement concept of working on the opposite side of the body to a joint? So I came to my opposite hand, and I stressed that medially, okay, and oscillated it 30 times, and that was probably 8 years ago or more, 10 years ago maybe. Boom, this stabilized. This has been stable ever since. It has never hurt me since then.
Okay.
What I theorize is that we're stimulating the type 3 mechanoreceptors, the nerves inside the ligaments, and what we're doing is we're creating a brief inhibition on this left side. And the body perceives threat because I use a moderate amount of force onto that joint, okay? And it inhibits muscle function on this side temporarily. This is just theory. It's a cross-body reflex, but it turns on muscle tone, prepares the other side, makes it ready to run. So if we're hurting this side of the body, he's going to run away with the other side. Okay? So there is some literature to support this, but I haven't fully explored it. But anyway, what I'm going to do is I'm going to stress this foot and ankle. So I'm drawing the calcaneus all the way forward, and then I'm gliding the talus posteriorly, doing about five reps. Okay? Now I'm doing a twist. I'm engaging the ankle joint and the subtalar joint or the talocalcaneal joint. Okay? And I just do about 5 oscillations, but it's very, very firm pressure. Okay? And now I'm engaging that cuboid, and I'm oscillating that cuboid up and down firmly. So I'm definitely engaging those ligaments. Okay? Now I'm grabbing the navicular, the midfoot, the cuneiforms, and I'm tractioning it towards my nose, and I'm twisting it vigorously to end range, and then I'm oscillating that. Okay? Then I'm keeping the foot in plantar flexion, and I'm pulling the calcaneus forward, stressing the most common ligament that gets injured, the anterior talofibular, and then the lateral calcaneofibular ligament as well, stressing those. Good. So let's now, let me also oscillate fibula superiorly. Very good. So now let's test the strength of the right foot. Go ahead, lay on your back. We'll do the weights later. Okay, so pull this foot up and out, and then give me everything you've got. Don't let me break it. Count of 3. 1, 2, 3, go. I cannot break it. I cannot break it. Okay, so go grab the weights and then do the standing on the right leg again. I think you're twisting farther than before.
Maybe.
What do you think?
Could be.
Are you aware of any difference?
Not extremely.
Uh-huh.
But
Okay. So show us what you're going to do for exercise. So the first one you're going to do standing and twisting. You're going to twist your body to the left, so your left foot points out to the left. Good. And then you're going to twist your trunk to the left, and you're going to stay there twisted left, and then you're going to do just little oscillations so that right foot is going into maximal pronation. And you're going to do 100 of those for 6 weeks. Okay? Good. And then grab the 5-pound weights, and then just do 3 reps of every direction that you're going to do. So you're going to go back and forth, and you'll go sideways. Nice. Nice. And then you're not going to twist at end range, but you're just going to twist your body gently left and right. Very good. Excellent. Okay, and then go ahead and sit down. And then once a day I'll have you work on a ball. You can buy one of these at a hardware, sporting goods store. Whether it has ribs or not doesn't matter.
Okay.
You're just going to put that under your foot and you're just going to roll it all around to keep movement in those joints.
Okay.
Okay? So this is day 1 of treating his right foot and ankle with what we call cuboid syndrome. And it was full blown because he had a restriction in all those other joints.
Yeah.
So basically that was a rigid supinatory pattern of the right foot that would not pronate. And now we have improved pronation, but we have a problem at his knee joint that I also have to treat, and that's going to influence his balance and endurance and strength. So we're going to go ahead and approach the knee now. So I'll stop filming here on the cuboid.